Gentlelady from Hawaii is recognized for 2 minutes.
Mr. Speaker, Democrats' top priority is creating jobs. We want to work with Republicans to achieve this goal, but instead of focusing on jobs and growing the economy, the new leadership has decided to start by debating H.R. 2, which will repeal patients' rights, put insurance companies back in charge, and add to the deficit. Yesterday, the Democratic Steering and Policy Committee held the only hearing the new Congress will have on this bill. We heard from families from Maine to Florida, from Rhode Island to Missouri, real people, real stories. Freedom was a common thread in their stories. Because of health care reform, these families are free from worrying about being denied coverage because of a pre-existing condition, free from worrying about escalating medical debt because of lifetime caps on their insurance plans. These families now have a sense of security and peace of mind. For over 37 years, thanks to Hawaii's landmark Prepaid Health Care Act, our families have largely been protected from some of the most unfair insurance company practices. But health care reform is still helping thousands of families and small businesses across my state. A mother in Kailua, Hawaii contacted me to tell me that she can now add her 21-year-old son and 24-year-old daughter to her work-sponsored insurance plan. This mom used to pay $900 a month for just her daughter's health insurance and prescription drugs. Now she pays $300 a month to cover both of her children under her company's plan. This family used to spend $10,800 a year for health care for one child. Now they spend $3,600 a year for health care for the entire family. I recently heard from a senior in Waimea on Hawaii Island who referred to her $250 Medicare donut hole rebate check as a blessing in these tough economic times. Let's be clear. The Patients' Rights Repeal Act will hurt, not help, middle-class families and small businesses in Hawaii and across our nation. I urge my colleagues to join me in voting against H.R. 2. Mahalo nui loa.